emergency drugs. Adrenaline. This medication is intended to treat severe allergies or reactions to insect stings or bites, foods, pharmaceuticals, or other substances in the event of an emergency. Epinephrine improves breathing, stimulates the heart, raises blood pressure, reverses hives, and quickly reduces swelling in the face, lips, and neck. The effects of this drug are immediate but short-lived. This drug should not be injected into hands, feet, buttocks, or any other part of the body except the middle of the outer side of the thigh. Atropine. Atropine is a drug used to treat symptoms of low heart rate, bradycardia, reduced salivation, and bronchial secretions before surgery, and as an antidote for cholinergic drug overdose or mushroom poisoning. Atropine can be taken alone or in combination with other drugs. Noradrenaline. Levoft, norepinephrine bitartrate, is a vasoconstrictor that works similarly to adrenaline and is used to treat life-threatening low blood pressure, hypotension, that can arise from certain medical conditions or surgical procedures. During or after CPR, Levoft is frequently utilized. Cardiopulmonary resuscitation. Noradrenaline is a vasoconstrictor that causes peripheral vasoconstriction and blood pressure elevation by primarily stimulating one receptor. At larger doses, it also possesses receptor agonist activity leading to a favorable inotropic impact on the heart. Calcium gluconate. Hypercalcemia, cardiac arrest, and cardiotoxicity caused by hyperkalemia or hypermagnesemia are treated with calcium gluconate. It's a calcium salt. According to the classification, oral calcium salts are used as a dietary supplement for people who don't obtain enough calcium from their diet. In people with high blood potassium, calcium gluconate is utilized as a cardioprotective agent. Magnesium sulfate toxicity is treated with calcium gluconate. Sodium bicarbonate. Sodium bicarbonate is a prescription drug used to treat metabolic acidosis, hyperkalemia, and cardiac arrest symptoms. Sodium bicarbonate can be taken on its own or in combination with other drugs. Alkalinizing agents are a class of medications that include sodium bicarbonate. Sodium bicarbonate. Sodium bicarbonate 5% injection. Injection may be used to treat metabolic acidosis, which can result from severe renal disease, uncontrolled diabetes, circulatory insufficiency due to shock, severe dehydration, extracorporeal blood circulation, and severe primary lactic acidosis. Amiodarone. Amiodarone is one of the most commonly used antiarrhythmic medications in emergency rooms. Amiodarone is recommended as the antiarrhythmic first choice in cardiac arrest with shockable rhythm, refractory, ventricular fibrillation, VF, or pulseless ventricular tachycardia, VT. 25% dextrose. 25% dextrose injection. USP is a sterile, no pyrogenic, hypertonic solution of dextrose and water for intravenous injection to treat hypoglycemia and provide carbohydrate calories. Nitroglycerin. This medicine treats angina, chest pain in persons with a heart ailment, coronary artery disease. It can also be used to assist prevent chest pain before physical activities, such as exercise or sexual activity. Succinylcholine. Succinylcholine is an intravenous, IV, skeletal muscle relaxant used as an adjuvant to general anesthesia to help with tracheal intubation and to relax skeletal muscles during surgery or mechanical ventilation. Dopamine. It works by increasing the heart's pumping strength and increasing blood flow to the kidneys. Dopamine injection. Intrapen is used to treat shock caused by a heart attack, trauma, surgery, heart failure, renal failure, or other significant medical disorders. Dobutamine. Dobutamine enhances blood flow by stimulating cardiac muscle and assisting the heart in pumping more efficiently. Dobutamine treats cardiac decompensation caused by weakening heart muscle in the short term. Dobutamine is frequently prescribed when other cardiac medications have failed. Lasix. Lasix is a prescription drug used to treat fluid retention, edema in people with congestive heart failure, liver illness, or renal disease. Lasix can be taken alone or in combination with other drugs. Lasix is a diuretic. Lidocaine. Lidocaine is a safe medication that is used in various fields of emergency medicine such as visceral, central pain, renal colic, terminally ill patients, headache, post-herpetic neuralgia, post-stroke pain syndrome, CR, PS, neuropathic pain, intra-articular injection, topical anesthesia, beer block, local and regional anesthesia. The most popular application of local anesthetics, LAS, which can give anesthetic for a variety of invasive operations, is infiltration. Adenosine. Adenosine is a prescription medicine used to convert paroxysmal supraventricular tachycardia, PVST, particularly that caused by accessory bypass tracts, to sinus rhythm, Wolff-Parkinson-White syndrome. Hydrocortisone. 13.39% W/V hydrocortisone sodium phosphate. This presentation can be used right away in an emergency containing the following circumstances: acute allergic reactions including anaphylactic reactions to medicines, and in status asthmatics adrenaline is supplemented by this drug. Vasopressin. After surgery or during abdominal x-rays, vasopressin is also used to treat or prevent certain stomach disorders. In emergencies, vasopressin is used to elevate blood pressure in individuals who are in shock. Midazolam. Midazolam is a benzodiazepine derivative that is 2 to 3 times more effective than diazepam. It is water-soluble and has a fast onset and brief duration of action and has a significant amnestic effect. These characteristics make it an excellent choice for outpatient sedation. Naloxone. Naloxone works by blocking or reversing the side effects of opioid medications, such as excessive sleepiness, decreased breathing, and loss of consciousness. A narcotic is a term used to describe an opioid in an emergency. Naloxone treats an adult or kid who has overdosed on opioids. Diazepam. In emergency cases, diazepam rectal gel is used to prevent cluster seizures, episodes of heightened seizure activity. In persons taking other epilepsy drugs, seizures, diazepam belongs to the benzodiazepine family of drugs. It works by relaxing a bare and brain overactivity. Paracetamol. Traumas to the musculoskeletal system are among the most prevalent presentations in emergency rooms. Paracetamol and non-steroidal anti-inflammatory analgesics, NSAIDs, are commonly used to treat traumatic musculoskeletal pain. Methylprednisolone. Arthritis, blood disorders, severe allergic reactions, certain malignancies, eye conditions, skin, kidney, intestinal, lung ailments, and immune system disorders are all treated with this drug. Methylprednisolone takes effect quickly. It takes 1 to 2 hours for an oral dose to reach its peak effect, and 1 hour for an intravenous dose to reach its peak effect. Heparin. Heparin is an anticoagulant blood thinner that keeps blood clots from forming. Heparin is a medication used to treat and prevent blood clots caused by various medical diseases and treatments. It is also used to lower the danger of blood clots before surgery. Aminophylline. Asthma, chronic bronchitis, emphysema, and other lung illnesses cause wheezing, shortness of breath, and difficulty breathing. Aminophylline is used to prevent and cure these symptoms. It relaxes and opens the airways in the lungs, making breathing easier. Phenergan. Promethazine is a medication used to prevent and treat nausea and vomiting caused by certain situations, such as before or after surgery or motion sickness. It is also used in combination with other medications to treat severe allergic reactions, anaphylaxis, and blood product reactions. When you cannot take promethazine by mouth, it can be used to treat mild allergic responses. It may also be used to make tired or calm before, during, or after surgery, as well as during labor and delivery. It may also be used to improve the effectiveness of certain opioid pain medications, such as meperidine. Promethazine is an antihistamine that works by preventing your body from producing a natural substance called histamine during an allergic reaction. Dexamethasone. The injection of dexamethasone is used to treat severe allergic responses, certain types of edema, fluid retention, and excess swelling, fluid stored in bodily tissues. Gastrointestinal disorders and certain types of arthritis are treated with it. Injections of dexamethasone are also used in diagnostic tests